Hello, everyone. Good afternoon, and welcome to today's live stream, Set Your 2025 Diabetes Goals with Gary Scheiner. I'm Kayla Bowen, Digital Marketing Specialist for Byram Healthcare, and I'm thrilled to be joined by diabetes expert Gary Scheiner. He'll be sharing his expertise on how to set realistic, achievable goals for 2025, optimize your management plan, and stay motivated all year long. Byram Healthcare has been a national leader in patient direct medical supply delivery for over 50 years, rated the best overall diabetes supply company by Verywell Health for 4 years in a row, with an A+ rating with the Better Business Bureau. We are your trusted partner in diabetes management. And at Byram, we know that life takes care, and today's conversation is one way we are fulfilling that purpose. Before we begin, please note, nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. Now, thank you, Gary, for joining again today. It's always a pleasure to chat with you. I'm sure most people know who you are in the diabetes space, but if you wouldn't mind giving us a little intro before we jump into today's topic, that would be amazing.
I'm kidding. I'm a legend in my own mind. Everybody should know me. Well, I've been a certified diabetes care and education specialist for close to 30 years now and run my own practice. It's a multi-specialty diabetes care practice that provides virtual care all over the world for people mainly with insulin requiring diabetes. So type 1, type 2s who use insulin, but we also work with anybody with diabetes. I've lived with type 1 myself since I was 18 years old. So that's 5 years ago. I was 39 years ago I was diagnosed. I like to experiment with new technologies and even the medications and new treatment methods that come up to be able to share that personal experience with our patients. And I've been a client of Byram for close to 20 years now, and been kind of a spokesperson for them for quite some time also. I love the work that they do.
Amazing. Actually, one of my colleagues, Daniel, started reading your book, Think Like a Pancreas, just recently, and he got through the first chapter, and he said he's already learned a lot. So
most people use it to cure insomnia. It'll knock them out in no time.
yeah. you know, I mean, honestly, like the takeaway that he gave me was about like eating before bed so far. How, your body, it's better not to eat close to bedtime for various reasons. I won't spoil it though. You got to go get a copy of Think Like a Pancreas.
I should follow that rule myself a little bit more often. Well, the thing is, people can eat right before bed if they choose to.
Right.
I try to teach how to adapt and how to manage the insulin to keep the blood sugars well controlled, regardless of what people choose to do. It's a bit more challenging to do if food is eaten right before we go to bed.
Right. Makes sense. Okay, so today we're talking about setting diabetes goals for 2025. So let's talk about the power of goal setting, maybe the psychological benefits of setting goals, and how small incremental changes can lead to significant improvements over time. And before we jump into that, I just want to give a little reflection prompt to the audience to think about one thing you'd like to feel better about in your diabetes management in 2025. Is it more energy, fewer low blood sugars, or maybe just more overall confidence? Hold on to that thought as we dive into today's discussion. So, Gary, tell us a little bit about the power of goal setting when it comes to diabetes management.
Whole idea of goal setting in general, whether it's for diabetes or not, is to make positive changes. Behavioral changes are what apply mostly in diabetes, although in some cases it could involve your treatment regimen or the devices that you use, but in most cases, it's related to our day-to-day behaviors. So the New Year's resolution concept of, I'm going to do this better. I've always been kind of benefit oriented, though. When I think about setting goals, I always want to have a reason behind it. Otherwise, why go to the effort and to do something like that and try to meet those goals? So I think first about what's in it for me, and not me, but whoever's setting the goal, what's in it for them. So if you want to make a change, how is it going to really benefit you? And that I think is an important place to start in goal setting. Is think about what you want to improve in your life, and then think about the behavior changes or changes you want to make that can help you get there. And from there, then I like to break goals down into little components and make sure they're goals that you stand a chance to meet. There's an acronym called SMART goals that we often use. And SMART, the SMART, stands for specific, measurable, achievable, relevant, and time bound. So it's probably worth talking about each of those.
Yeah, absolutely.
And I'll use my own goal this year as an example. Come first of the year, I set a goal of being better hydrated. It's something I've never paid a lot of attention to is hydration. And I think it affects me, not just throughout the day. I sometimes get a little lightheaded, but I think it also affects me when I work out and when I play basketball, because I think my energy level is not quite what it could be, and my stamina and so on. So I just felt that being better hydrated would benefit me in those areas. And it's not just hydration; it's the type of hydration. This is probably a bad example. I mean, I drink a lot of diet soda, so for me, it was about adding water. So my specific goal is to consume more water. That's the specificity. You don't just want to say I want to be healthier, I want to be better hydrated. In my case, I want to drink more water. So that's the specific part. The measurable part was I got to define what I mean by more. It's not just to say more. More could be this, could be this. So in my case, I said I want to, in addition to what I normally drink, I'm going to add 2 cups of water a day. 2 cups per day. It seems like a measurable type of a goal. Like at the end of the day, I can say, yeah, I had those 2 cups, or I didn't have those 2 extra cups.
Right.
The third part is achievable. It needs to be realistic. I'm not going to go from hardly ever drinking water to drinking nothing but water. I'm going to eliminate soft drinks entirely from my repertoire.
Right.
Do you drink like Diet Cokes or anything like that?
I do.
Yeah. And it's a hard habit to break, isn't it?
Yeah, because sometimes you just want that like sweet fizzy vibe.
Yeah. Yeah. So, and I drink them so much, I just decided, all right, I need to include water in my day and not just be drinking soft drinks. So it's an achievable goal, having the 2 cups of water a day. I can still have the soft drinks if I want them, but I think 2 cups is an achievable goal. And that's an area where a lot of people end up failing and not sticking with their plan, is they set goals that are unrealistic. I work with a lot of people who are not active and want to become active. And before we start exercising for 60 minutes every day as a goal, we talk about maybe a few days a week, getting in 15 to 20 minutes, and then building from there if you choose to.
Right.
So the achievable part needs to be a focus. The relevant, and the relevancy of a goal, I actually do first. So when I talked before about being benefit oriented, the goal needs to involve something that's going to help you improve your life in some way, benefit you in some way. So even though the relevant is 4th on the list, it's actually the first thing I would ordinarily tackle. Is think about how you want to make your life better, and then work through the other items. And the last part of the goal is being time bound. stating, when you're going to achieve this or for how long you're going to do this. In my case, it wasn't really that I'm going to do it for a set period of time. It was a change that I wanted to implement, throughout the year. I wanted to do this throughout. So for me, my plan was to start at January 1st and continue indefinitely. Whether permanency is achievable or not is another, that's another story. But I felt since it was a manageable goal, a realistic expectation, it was something that I could do. So thinking about your goal, just a little bit of planning goes a long way.
Right.
And you've heard this saying, no one plans to fail, we just fail to plan. So if you plan your goal a little bit, it doesn't take a lot, just do it a little bit, your chances of meeting it and fulfilling and experiencing those benefits goes way, way up.
Right. How are you doing on that goal?
Pretty well. I missed a day here or there, but for the most part, I've been pretty conscientious about getting the water. It's easier at work because we've got a water cooler right outside my office. When I'm home on the weekends, I got to kind of remember.
Right.
I probably need something to prompt myself to have the water, like maybe put the water at the front of the fridge and the sodas in the back. That might help.
Yeah.
Got to be flexible too.
Yeah.
Even if you don't meet the goal every day or you don't meet it exactly, it doesn't mean you need to just give up. You can get back on the horse and say, all right, this week I'm going to try to do a better job, or try to meet that. So are there any goals that you had for the year?
I mean, actually, one of my goals is to drink more water. So
get out of here.
I relate
what a
to
good
that.
I love that goal.
Yeah. So I've been doing pretty well with that. Another goal is to just be more physically active during the day because I do a lot of sitting in front of the computer. So trying to just like take breaks every now and then to just stand up and walk around the office or something, just to get the blood flow and whatnot.
Well, let's take that and maybe create a SMART goal.
Sure. Let's do
You
it.
said being more physically active, reasonably specific. I want to think of what you mean by physically active. I mean, do you want to get a workout in every afternoon, or do you just want to be up moving more than you are currently?
Well, I guess that's a good question. I guess I haven't really fleshed this goal out as much as I should have. But
now's as good a time as any. Let's do it.
Why not? There's no like pressure to have your goals like, solidified by January 1st. So, yeah, I mean, I want to get I really it would help if I probably had like a Fitbit or something like that, but I don't. But yeah, I would just like to maybe let's say I'd like to go to the gym at least twice a week.
Okay, that's a measurable goal. So you've achieved that aspect of a SMART goal. Achievable. Realistically, are you going to be able to get away and set the time or block the time twice a week to do that?
Yeah, I think I can because I have 2 days that I work remotely. So that means that I'm only 10 minutes away from my gym. So I can easily do that right after I'm done with work.
Okay, so it is achievable. How is it relevant to your life? How do you feel you'll benefit from achieving this goal?
Well, one very obvious thing for me is that I live on a third floor walk up, like in a third floor walk up apartment. So I definitely feel the difference if I've been physically active by the time I get at the top of those stairs and I'm not like huffing and puffing. So that's definitely one example. And also just being able to take, walks or hikes over the summer and not feel tired out as soon.
Just being able to enjoy daily life.
Yeah.
At some point you might be taking the steps two at a time. You'd be in such good shape.
Yeah, right?
Yeah. And the time bound part of it, it sounds like this is something you'll want to do like mine on an ongoing basis. It's not just a
Yeah.
specific thing you want to achieve in a month, but you can also set your goal on a short-term basis. You could say, all
Mhm.
right, for the month of January or the month of February, I'm going to get to the gym twice a week
Mhm.
for a workout.
Right.
That meets all the criteria for a SMART goal.
Right. And then maybe once I've gotten to that point, I can say, now I want to try 3 days a week. And
Mm-hmm.
I can have my new SMART goal for the next 2 or 3 months. And then maybe by the end of the year, I'm going 8 times a week,
Yeah,
But, yeah,
8 days a week. That was a Beatles song.
right?
Yeah,
Yep.
yeah. Goals have to be adaptable because life changes, situations change, and right now, if you went to the gym, also you might only be able to, let's say, walk 3 miles an hour on the treadmill. That's going to increase.
Right.
Your goal might be you get on the treadmill, I'm going to build up to 4 miles an hour for 30 minutes. And you can set goals as far as how long you do it for, the intensity level, and so on.
Right.
So, yeah, the goals adapt and change over time. And also, if you find that the goal is not achievable, that you're struggling, you can certainly problem solve where you can adjust your goal and say, listen, I just can't do that twice a week. So I'm going to go once a week, but I'm going to take a walk, at work a couple of days. I'm just going to take a half an hour, go for a walk, or spend my part of my lunch for a walk. So
Right.
adaptability is important as well.
Right. Yeah. The adaptability piece is really important because I feel like a lot of people get so hard on themselves and disappointed when they don't meet a goal, and then they just let that stop them from continuing on. There was someone I was speaking with recently who said, I don't want to set any goals for myself this year because I'm just afraid I'm not going to meet them. And I was like, I mean, you got to just accept that that might happen, and not let that, stop you from having goals and wanting to
Sure.
better yourself. Um,
Yeah, so you set a goal that you'll be able to achieve. Even if
right,
it seems ridiculously easy, it's satisfying.
right.
Who
Mhm.
doesn't like meeting a goal, even if it was something that wasn't that difficult to achieve?
Right.
Meeting a goal makes you feel good and good about yourself, and you're ready to maybe go to the next level.
Absolutely. And that actually made me think that something that would probably help me to meet my goals and to continue like going to the gym twice a week, for example, would be to have a little chart or something on my fridge where
Mhm.
I can put a sticker every time or like check it off or something every time I go. Because there's something like whenever I get home, because there's something like satisfying about like checking something off physically or like just having that physical, like you can see it that I did it that day.
Yeah,
So maybe that's
I
another.
do that myself with my workouts. I've got a calendar. Every year, my kids, they get me a Simpsons. I love the Simpsons. They get me a
Oh,
Simpsons calendar I put up in my bedroom, and I keep a running count of the workouts for the year.
nice.
And yeah, just that checking something off or keeping a count. It is. I find it very very motivating seeing that. I mean, I'm kind of self motivated to work out anyway, but it keeps me
Mhm.
even that much more motivated.
Yeah.
There's a lot of motivational strategies that people can apply, especially when it comes to lifestyle kinds of
Mhm.
goals involving your diet, your activity, stress, sleep, things like that.
Right.
Having writing it down does help. Having it written
Right.
uh, does matter, not just kind of floating around in your head abstractly.
Right.
It
Like
does
putting on the
help.
calendar, I'm going to go to the gym this day.
Yeah, yeah.
Yeah.
Sharing the goal with other people because
Mhm.
that makes you accountable.
Right.
And it could be a family member, a friend, a coworker, or even your healthcare team. sharing the goals that you've set with other people, makes you feel accountable, because
Yeah.
now you're some kind of not just doing it for yourself, but you're also,
Right.
you want to show them that you can do it.
Right. Right. Absolutely. We've
Partnering
gotten
with
a few.
other people is great too. Having
Yeah.
someone else who might have similar goals and working together and supporting each other.
Yeah, definitely. We've gotten a few comments while we've been chatting that I'm just going to read. So, we got a comment from Eric saying, "My biggest issue is remembering to drink water." So, I think that that's a lot of people's challenge is remembering to get enough water a day, because I think we need more than a lot of us realize on a day to day basis. Um,
Tying things like water consumption to other things that you might be doing. So maybe every time you open your email,
yeah,
you drink water. Just finding some activity you do throughout the day and tying that to drinking some water, it might help you to drink more.
right. That's a good tip. We also had another commenter say that her 2025 goal is to be more consistent with taking walks when it's not single digit temperatures. And another person said that their goal is to work on mobility, not forgetting to stretch before and after workouts. That's a good one. Um, and then we had Pamela say that I'm terrible at setting goals and it's hard to start, quite honestly, since I'm older, 66 years old. So, what do you think about that, Gary? Being, let's say, 66 years old, you know how they say the saying, can't teach an old dog new tricks. Not saying
Yeah.
that 66
I
is
mean,
old, but.
there's certainly more challenges we face as we age.
Hmm.
But there's also more opportunities. We may not have as many work or family responsibilities as we age, so it affords us the time and ability to do certain
Right.
things. But the whole notion of you can't teach an old dog new tricks, that's nonsense.
That's
Anybody, any age, can learn and do things. I don't like to use that as an excuse. But do consider what your challenges are going to be. Your physical challenges, your limitations
right.
physically, what you have access to on a regular basis, and even from a food standpoint, we have these things called food deserts where people live in areas where they can't really access healthy foods. They don't
Right.
have fresh produce available, quality meats. They're buying a lot of packaged foods from convenience stores. And
Right.
it's generally not the healthiest stuff. So there are challenges. But anyone, if you sit down and think it through, you can figure out ways around those. Uh, it's the thing. Any goal you set, it's going to require a little bit of work on your part, a little commitment. But you think again about how it's relevant to you, how you're going to benefit, and you weigh the pros and cons, and hopefully you'll find that the pros far outweigh the cons of the
Yeah.
changes you're going to make.
Right. Um, I've heard that it takes something like 3 weeks, 2 or 3 weeks to really like build a new habit. So if you could stick it out for a couple of weeks.
That's true, and that's why a short-term goal over maybe just a week or 2 weeks is a great way to start.
Mm,
'Cause it does tend to get easier once you establish a repetition, a habit, a tradition in your life. It becomes more natural. It integrates into your life. Now, change is never easy. And I use a train as an analogy. There's so much energy that goes into getting a train moving. But once that train is moving and it's on the tracks, it just glides.
hmm.
So it's that getting started part and just that short term push out of the station, getting yourself going and maintaining it for just a while, then you can glide after that.
Right. Another thing that I have learned in the past few years is that it's generally like not a good idea to like wait for motivation to come. Rather, it's better to just push yourself to take the first couple steps, and then that's when motivation comes, once you're already moving. And you made me think of that with the train thing, how you have to put all this energy in at the start, but once it's going, it's going.
Yeah,
So,
motivation can come from so many different sources. For some people, they may get bad news from their doctor. They may have high cholesterol. They may be developing a heart condition, whatever. But sometimes that's the motivation. The goal is to try to, I guess, do the right things to prevent those problems. But if it serves as motivation, let it.
yeah.
It's a movie with Adam Sandler called Waterboy, if you ever saw it. But yeah, he was this little runty guy, but he could tackle people on the football field because he would get angry at them. He'd picture something he didn't like, and
Mhm.
he called that his tackling fuel. So I use that as a motivational term now. You have to find your tackling fuel. What
Mhm.
is it? Are you just tired of how you feel? Are you tired of looking a certain way? Is there something specific you want to achieve, a goal you have in long-term goal you have in mind? Uh, but whatever motivates you, go with it.
Right. And it might be a good idea to, just spend some time on a regular basis picturing yourself having achieved that goal as a motivator as well.
Yeah, we call it visualization.
Right.
Picturing yourself in that state you want to be in.
Right.
Yeah. There's other things like some people they journal,
Mhm.
similar to your star idea on the
Yeah.
calendar or my keeping number, just tracking the number of workouts.
Right.
But journaling, writing down, I didn't eat cookies today. I missed them, but I feel proud of myself. That's
Yeah.
a nice thing to do.
Yeah.
Not that we have to eliminate cookies, but if that's your goal, then
Mhm.
journaling's a good way to do it. Yeah,
Yeah.
and giving yourself some reinforcement, positive reinforcement for accomplishing things, treating yourself to new clothes, to a night out, and little minor rewards,
Right.
short-term rewards for doing something for maybe a week or two, and not having to wait till the end of the year to see results and feel
Mhm.
like you benefited. You
Right.
ever find a way to reward yourself for a job well done?
Hmm. Well, I find that just still on the going to the gym thing, I find that on the days that I really don't want to go and I push myself to go anyway, then
Mhm.
afterwards, just the endorphins and everything, like, I just feel so good and so
Mhm.
happy, like, especially glad that I went when I really didn't want to. Um, but I guess other little rewards for myself would probably be like buying myself I like to have like these little figurines on my desk at work, just like little characters from different things. Um and they come in these things called like blind boxes or surprise boxes where you open it up.
Mhm.
Before you open it up, you don't know which character you're going to get. And that's like a nice little reward for myself to to get myself one of
Nice.
those little surprise boxes and then have a new figurine on my desk. So,
In the wintertime when it's so hard, sometimes to get outside and do things, because in the warm weather months, I get out in the yard, I get a lot of activity, but sometimes the winter workouts can get a little boring. So
mhm.
I made a deal with myself that anytime I do the kind of the cardio workout indoors, that I have a show I really like on Netflix, and I only let myself watch another episode during a workout. So to me,
Ah,
it's rewarding that I get to see the next episode if I work out.
which show? I'm really curious.
The one I'm watching now is called Supernatural.
Oh, yeah. A lot of people love that show. I haven't seen
Yeah,
it
but there's
though,
been a
but
variety of them. Yeah.
yeah.
I like the monster zombie concept. So I was a big
Mhm.
fan of The Walking Dead when it was
Oh
on.
man, me too. I love that
Yeah.
stuff.
I figured that if there is a zombie apocalypse, the first thing I'm going to grab is a Frio pouch to keep my insulin fresh.
Mm, mhm.
You don't need to refrigerate it or no batteries. It just water
Yep.
evaporates. It keeps it cool. That'll work till the end of time if I need it to.
Yeah, you gotta think about these things, right? You never
Mhm.
know. um, what was I gonna say next? Oh, so you work with a lot of different people with diabetes. I'm curious, like at the start of the year, are people in that vibe of thinking about their goals for the year? Do you have a lot of conversations with folks about setting goals?
Yeah, a lot of them are, and in our case, because we focus pretty heavily on glucose management, a lot of people's goals are related to these and blood sugar control.
Mm-hmm.
But again, we try to rein them in and make sure that the goal that they've established is realistic and achievable, et cetera, so that it fits that quality of a smart goal. For
Mm-hmm.
example, some people want to get to unrealistic average numbers, or their time in range. They might be at 80 or 85%, and they want to get to 90. And then we ask them, well, how do you benefit from that? Let's take a step back. How is that really going to offer you an advantage? And they can't really answer that. And if they can't really answer it, when we think, well, maybe we should work on something else, like cutting down on the lows that you're having, or maybe easing up on the amount of work you're having to put in to your diabetes management. Because for some people, it's not a matter of working harder at their diabetes; it's easing up a little bit, getting
Mm,
some of their own personal life back, and not having diabetes be such a huge part of it.
right.
And that might be that we got to invest in some new technologies that'll help self-manage to a certain extent, or change the expectations that they have with their glucose regulation. So it does work both ways. Some people won't need to tighten up, others need to loosen up a little bit.
Right. That's a good point. Um, so how can someone manage or handle common barriers to achieving a goal like stress, busy schedules, or anything like how can someone stay flexible to accommodate unexpected changes like illness or travel when they're thinking about a long-term goal for the year?
And be smart about it. If you're not a morning person, don't schedule yourself for morning workouts.
Mhm.
If the climate you're in is not conducive to outdoor activity most of the year, don't set your goal around outdoor exercise.
Right.
Uh, if your schedule is really erratic and you have to eat out a lot, don't make sure that's incorporated into your goal set. So consider your situation, what's achievable realistically when establishing your goals up front.
Right. So,
But again, I do feel that when the going gets tough, the tough adapt. We do have to be able to adjust to the situation.
right.
It may be that the goal needs to be adapted, or it may be that the way we're striving to meet that goal needs to be adapted.
Right.
So if schedules change, if your health conditions change, we have to be able to adapt to these things. I'm an exercise physiologist by trade. That's what my schooling involved. So early on, when I was only working with people on their physical activity and with their diabetes, I ran into folks who had a lot of serious complications. They had foot problems, neuropathies, retinopathies, circulatory issues, all kinds of things. But we figure out ways to be physically active and just adapt them to that issue that they're facing. So
Right.
somebody who has serious problems with their feet, we do what are called non-weight bearing exercises, activities where they're not putting pressure of their body weight on their feet. It works fine. You can get great cardio fitness that way.
Right.
If somebody has blood pressure issues or severe retinopathy, we have to be careful about certain activities that we have to stay away from, but there's still a lot that can be done. So it's a matter of just being adaptable to the situation.
Right. So, Gary, what role do caregivers or family members play in helping someone with diabetes achieve their goals?
Really depends on the goal and their age and all that. If it's a child, the parent really needs to supervise and be directly involved in the management. But with most adults, we would look for family members to simply be supportive. As I mentioned before, sharing the goal with family members provides a certain degree of accountability. Can I offer some additional motivation to an
Right.
individual? But I think we can all relate that we don't want somebody hounding us. That doesn't help.
Mm-hmm.
That's it might deter us from achieving the goal just to spite them.
Yeah.
So, just letting them, having them be supportive, but not pressuring us and not forcing us. That's really the family members and the loved ones' role.
Yeah, that makes sense. You don't want to push too hard. Um, how do you address emotional burnout from constant stay on track with goals?
Burnout with diabetes is very common. And I wouldn't say it's normal because nobody wants it, but it happens to most people with diabetes at some point. Living with diabetes puts a whole layer of responsibilities on top of everything else that we're responsible for in our lives. And with diabetes, I guess the goal overall is to do all this work to manage it so that eventually nothing happens. Think about that. It's not intrinsically satisfying. So we have to find, I think, little ways to get satisfaction out of the diabetes management. And a
Mm-hmm.
lot of that can come from appropriate goal setting. So if you look at your glucose data and you find that either 50% of your readings or 50% of your sensor time is in your healthy range, your desired range, just setting a goal of getting it to 55%, that can be motivating. That can help get through the burnout to a certain extent.
Mm-hmm.
Trying new things can also help overcome burnout. It's kind of like going on why we go on vacation. It's not so much what we're doing or not doing on vacation, it's just being somewhere new and different
Mm-hmm.
that refreshes our brains and gets us kind of reset and
Right.
relaxed. So, trying new things, new technologies, new management approaches can make a difference, can help people overcome burnout. And I do think it's reasonable to take a diabetes vacation. And I just wrote a column about that very thing, about what a diabetes vacation involves and how we can really benefit from it.
Hmm.
Uh, my wife took me on a cruise back in December, and I hadn't had a vacation all year, so I really needed it.
Mm-hmm.
And what I decided was I was not going to worry about my blood sugar levels. I was just going to give myself insulin, a rough approximation of what I needed when I ate. But I set my alerts on my sensor at pretty extreme levels and just didn't worry about it.
Mm-hmm.
Um, and just not thinking about the diabetes that much, it really was nice.
Yeah.
And I look back at my data during that week, and it wasn't that much worse than when I'm focusing and worrying about it a lot.
Hmm.
So it taught me that relaxing a little bit and not focusing so much is beneficial. So,
Right.
make as many stress hormones, you can make better decisions. So
Right.
it does benefit us
And the stress plays a role in those levels as well. So,
in a big way. But there are people, a lot of people also develop more serious or acute forms of burnout or anxieties about their diabetes. And when that happens, there's nothing like working with a professional counselor. My team has two licensed clinical social workers who work with patients who run into these kind of issues. And it's mostly talk therapy and problem solving, but also sometimes it's referral for medical treatment. If you need it, you need it. And if it makes your life better and helps with your diabetes management along the way, it's very worthwhile.
right. Absolutely. So with all the folks that you've worked with over the years, Do you maybe have an example of someone that you've worked with who set a goal and made a big difference in their health by sticking with it? Or maybe it's you or
I do have someone in mind. This is a real estate business, and he required a lot of insulin, and it was mainly because of the data he was under. Because when he would go on vacation, his insulin by about 50%. And trust me, he was eating plenty on vacation. It's not like he was dieting when he was on his trip.
right,
But on vacation, his stress levels just really dropped. And he noticed that. And I noticed that. We discussed, he realized that the stress he was putting himself under was having an effect on his life.
right,
Right? So he decided then and there to work on managing his stress at home, and his work environment as well.
hmm,
So he set a specific. He learned how to meditate,
hmm,
and he did that a couple of times a day. It helped him focus better. Different approaches work for different people.
right,
Some people manage their stress by journaling, catharsis that's for a lot of folks. We'll turn to anti-anxiety medications to be able to relax better. Some people use physical activity and exercise to relax. So there's a lot of different techniques, practice Tai Chi or yoga, whatever you're going to do.
right.
But for him to manage his stress better at home made a world of difference for him. So that was the example that popped to mind. I think we were talking about stress anyway, so that one kind of
Yeah, that's a
stuck.
great one. Yeah, I mean, noticing that huge difference in the numbers being on vacation versus, day-to-day life, and I feel like for a lot of other people, the numbers are the opposite because when you're on vacation, like you said, you might not be paying as much attention. You might be giving yourself that break to just kind of, you know, not be tracking not be so on top of the tracking, and you might be eating more carbs or whatever. So that's really interesting.
Yeah.
He had the
You
opposite.
know, this day and age, it's a timely goal for any, but given the incidence of COVID and other airborne communicable diseases, for anybody with diabetes, we know that when we get sick, it becomes really difficult to manage our diabetes, and they feed onto each other, so it's a real problem. But doing things to prevent common illnesses. So setting a goal of making sure that you get your immunizations,
Mhm.
your vaccinations that you should get, that you're washing your hands at certain intervals during the day, that you've got a good humidifier at home so the air is not dry and you don't have cracked nasal passages that let bacteria in. Things like getting outdoors, not spending too much time indoors. The outdoor air is a lot healthier for us. These are the kind of things that can help prevent illnesses or prevent serious illnesses that help anybody.
Right. Um, okay, so I mean, we have really ran through most of our outline here today. Do you have any like closing thoughts that you want to leave our viewers with?
Diabetes it's a tough disease to manage. I've been doing it 39 years for myself, and every day is a new challenge. So I understand how that is. Um, I have 8 clinicians that work with me. My all have diabetes themselves, so we live it. We understand that. I want people out there to realize that getting help with this is normal. I mean, people who succeed are the ones that surround themselves with good people that can support them, help them with the challenge, overcome the challenges, and also learn how to self-manage
Right.
more effectively. So I would say for a lot of people, a really good goal for the year, or whatever, would be to maybe work with a certified diabetes care and education specialist. They used to call us CDEs, but the name's gotten longer. But to work with somebody who can offer some insight, provide maybe a tune-up with the glucose management,
Yeah.
help with some other goal setting that you might have, and help you achieve those. Most CDs or CDCSs have pretty diverse skill sets. We're not just experts with diabetes care. We've got a good metabolic health and lifestyle, mental health, that sort of thing. So,
Right.
uh,
And you've got a
but if
pretty
you have the
diverse
work with
team.
them, yeah, we have dietitians, nurses, exercise physiologists, social workers. So we can really tailor the care to what a person's needs are.
Right.
And if you don't have somebody that you accessible to you at your doctor's office or your hospital, you can reach out to us. We do it virtually all over the world, so it's easy enough.
Great. Well, remember those SMART goals. SMART. What could you remind our viewers what those stand for again?
S is make it a specific goal, something that's measurable so that you can evaluate how well you're doing in meeting it. It should be achievable. Make it realistic. Consider your situation, your capabilities, what you have access to, and what you can picture yourself actually doing. Make it relevant. It might be the first thing you want to do is consider why you're doing this. What's your tackling fuel to make these changes, to do these new, different things? What's in it for you? And that will help keep you motivated. And in many cases, make it a time-bound thing where you're going to say, all right, my goal involves doing such and such for this period of time, this 2-week period, this 1-month period, whatever it might be. That helps with long-term adherence because nobody wants to think about doing something the rest of their life. That's a hard pill to swallow.
Right.
It's a lot easier to swallow. I'm going to do this for 2 weeks and then I'll reevaluate and see what's happening.
Right.
But like you said, most people, after they've done something for a few weeks, it becomes part of your mindset, part of your lifestyle already. And the
Right.
train just glides at that point.
Right. I love that train analogy. That was really good. Well, thank you so much for joining us today, Gary. It's always a pleasure. You always have so much insightful, helpful information to provide our viewers. I just want to remind everyone of our disclaimer that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. Remember, if you don't already follow us on Instagram, follow us at Byram Diabetes Care. For the month of February, we will be discussing diabetes and relationships. So stay tuned for some great content on that topic. And yeah, thank you again, Gary.
Anything for Byron. I love the company. They do great work.
Thank you. All right. Everybody have a great rest of your Thursday and a wonderful weekend. Bye.